The total number of deaths here in the United States related to COVID-19 is now past 180,000. And to discuss what happens next is Dr. Simone Weil. She's an infectious disease specialist at South Shore Health. Doctor, it's great to see you.
Thanks for having me.
Since the first death linked to COVID-19 back in February, you've seen hotspots appear in different parts of the country at different times. First, it was the state of Washington, then it was here in the Northeast, then it went to the southern states. Now it appears to be the Midwest. So do you think it's too difficult at this point for this country to get a widespread control of the virus?
Well, as we see in each area, we're having different hotspots. I think what we really need to do at this time, where we have the hotspots, we have to go to extreme measures. We have to go back to lockdown, which I'm sure some people might not be happy about, but I think we have to do extreme measures to get things under control. We also need to make sure that we are practicing universal masking. We have to ensure that everyone is practicing social and physical distancing as much as possible. And in some cases, we have to even put curfew in place. But another point, which is really important, is that we need to get testing done, because the more people we can test, then we can isolate them and we can get to do contact tracing. So these things are very important to get things under control in all these different states.
So, doctor, in your opinion, what is the risk right now that school reopenings could trigger a second major outbreak, specifically here in Massachusetts?
Yes, Erica, great question. As kids go back to school, yes, I think we're going to be expecting to see a lot more cases, but, we still don't have a lot of information. I think as they go back to school, they're going to be interacting with other children, and so the odds are that the numbers are going to increase. And guess what? When they go home to their families, extended families that have underlying conditions, and they might get the illness, and we will see higher numbers.
Yeah, absolutely. So obviously, everybody is learning in every step we go. But the World Health Organization released new guidelines today urging tests for people who have been in close contact with a COVID patient. And that is the exact opposite of what the CDC said and it just recommended. So why does the WHO think it is so important to test more people, even if they don't show symptoms?
Eddie, the big thing is the CDC did not follow, the guidelines didn't follow the science, right? And I think we need more explanation, because we do know that pre-symptomatic individuals are very contagious, and we need to test those individuals. So to not test them is going to increase the risk of transmission, which is going to create lots of problems. Another issue that needs to be addressed is the testing. The testing is taking way too long.
Right.
We need to be able to get results in a timely manner.
Right.
And that has to be done quickly.
Excellent point. Excellent point. Dr. Wiles, thank you so much for your time. Be well. Great to see you tonight.